South Africa tonight. A change of plan at the moment. We're not bringing you sport, but we will take you to Geneva, Switzerland, where a World Health Organization briefing is underway. After that breaking news, a
big announcement a little earlier. It's the coronavirus has now been declared a pandemic, previously an epidemic. Live to Geneva. Let's listen to the World Health Organization briefing.
Have accelerated very, very quickly over the last couple of days, as have France, as has Norway, as has Denmark, and as have a number of European countries. So it's very important that countries in the European Union and in Western Europe really do look at what their current control strategy is for this disease, and to assess whether the efforts they're taking are good enough in terms of suppressing transmission and pushing back the virus, and then obviously preparing their health systems to cope with the cases that do occur. All countries need to review their strategies right now.
Yeah, thank you. I would be happy to add to that. I had a very good discussion with His Excellency Prime Minister Pedro Sanchez of Spain 2 days ago, and I was, very much impressed by his commitment. And Spain is using the whole of government and whole of society approach, and we believe that that political leadership is really key. And we discussed about that approach mobilizing the whole society and making the response everybody's responsibility. And we hope to see progress in Spain too. The Prime Minister took the initiative to call WHO and to consult, and that's a very important measure, actually, indicators of leadership. And he told me that he's prepared to do everything to stop this outbreak. Then on containment and mitigation, again, we don't want anyone to make a mistake. When we, say the situation now is pandemic, we are not saying that the world should move from containment to mitigation. We are not. We believe as WHO that the comprehensive or blended approach should continue. And in that comprehensive and blended approach, containment should be the major pillar. As Mike said, the numbers themselves actually speak why we're saying this. 81 countries have no cases, so they should do everything to prevent from importing any case. They shouldn't give any ground for this virus to set foot in their country. And then there are 57 countries who have reported less than 10 cases, 10 or less cases. They can cut it from the bud. 81 plus 57 is 138 cases. And 90% of the total number of cases we have, the total 118 cases globally, 4 countries reported 90% of it. 90% of the 118,000. So it will be a mistake to abandon the containment strategy. Of course, the rest of the countries will be between the 4 countries who have reported more than 90% and those who have reported 10 cases or less. So we believe that the best way forward is the blended comprehensive approach, which puts containment as a major pillar. And we have also given examples. Many countries have already shown that when you have cases, still can be contained, however big the number of cases is. And we are convinced that although this is the first coronavirus to be labeled as pandemic proportion, But at the same time, we believe that it will be the first also to be able to be contained or controlled. That's what we are saying. It can be, because we have seen progress in countries that have already shown this. So we repeat again, we're not suggesting to shift from containment to mitigation. We are not. We underline that. We're still proposing containment strategy and other strategies, a comprehensive and blended strategy. But considering the geographic spread and the number of cases that has increased in the past 2 weeks, we should double down and we should be more aggressive. That's what we're saying.
Thank you very much. We will now call on Christophe from Rwanda. Christophe, can you hear us?
Yes, I can hear you. Thank you very much. I hear you well. I have a couple of questions. The first, I want you to give us an overview of the status of preparedness and quarantine centers. What? Can you see? Can you hear me? May I go ahead? May I go ahead?
Christophe, can you try one more time? You are broken, but please go ahead. We heard that it's something about preparedness, but repeat your question, please.
Okay. I want you to give us an overview of the status of preparedness and response in Africa in terms of surveillance, treatment centers, supportive treatments, availability in Africa. Secondly, there is an unverified information that black people are resistant to COVID-19, and this is affecting people's willingness to implement preventive measures. What's your comment on this? Thank you.
Thank you, Christophe. I think actually Africa in general has made very rapid progress in its general levels of preparedness over the last 8 weeks. All countries in Africa now have the capacity to make the diagnosis, and some are demonstrating that, unfortunately, through the diagnosis of COVID-19 cases. A lot of syndromic surveillance systems, early warning systems, polio systems in Africa are now being turned towards detecting ARI. The network of 2 reference labs for influenza surveillance and the network of labs for national influenza labs have been working together on detecting doing systematic testing in samples collected with suspected flu, and they're now testing those samples systematically for COVID-19 across a number of countries in Afro. 41 of 47 countries in the Afro region, the Afro region is essentially sub-Saharan Africa in Africa for WHO, have completed comprehensive national action plans for the control of COVID-19. At the moment, we currently have our staff working today in Washington, completing the mechanisms by which funds will be released into those plans. But in the meantime, as that has been done, we have sent millions of dollars through our WHO system to provide support for training, provision of PPE, further support to the labs, etc., etc. We can provide more of a detailed update from our Africa office on other matters, but there still remain concerns and weaknesses, and the things you mentioned there, like isolation facilities. For example, in Congo today, yesterday we had our first case. We're already redirecting some of our Ebola response capacities towards the potential isolation and treatment of cases. I think in other countries, in Nigeria, for example, within 48 hours of the first case, Nigeria had established a 100-bed isolation unit. So, but I think the development of the clinical support and isolation services is uneven. And while it may be present at national